I'm going to turn it back over to the audience in the field to ask questions. You've heard from some amazing presenters up here today who have different experiences. So I want to wonder if anybody from the crowd has a question.
Thank you very much. I'm just fascinated by all these stories, and putting them together in a synergistic kind of way is very stimulating. My name is Maris Ash. I'm recently retired and actually spending some of my time volunteering in local public schools. But I ran a public policy shop here in Oakland, Change Lab Solutions, where we looked at law and policy and the impact on community health. And some of our work was focused on schools and supported by the Robert Wood Johnson Foundation, so there's a lot of integration here. My question for you is a public policy question, and when we talk about how to destigmatize the issues around mental health and connect that to school discipline in particular, and what are the policy choices that are available to schools, whether it's financing, teacher training. After the Parkland incident, and we've been talking about hardening schools, getting teachers with weapons to protect students, all these kind of crazy ideas, but those are public policy choices that have resonance in some parts of our country and some parts of our federal administration, probably state administrations too. What are the countervailing policy choices around more security in schools and more of a police presence in schools versus the mental health approach that we're talking about today? And what are those trade-offs, and what recommendations would you have to the rest of the nation from your learning about what's working and what's not working to keep our kids safe and to foster the learning environment we want for them? Thank you.
So in Broward County, well, the state of Florida, there has been an establishment by the governor known as the MSD Public Safety Commission. And so the MSD Public Safety Commission has put in place a very thick document that regulates new policies and procedures related to safety and security to all our public schools. I will make sure that I'm able to provide that PDF, and then it could be shared amongst everybody here because it's very, very extensive. And it also is applicable to our charter schools. So for an example, in Broward County, we had an incident that occurred, and it happened to be the Public Safety Commission was having the meeting in Broward County at this time, and one of the charter schools were not in compliance based on the mandate that had regulated to having the contracts in place for either a not guardian litem, but either a BSO officer at the school or additional type of security at the institution was not in place. So it was mandated that that charter school had to be shut down, which meant those students were either going to be fed into other schools or the Broward County school system was going to take it over. The Public Safety Commission was pretty much politically trying to advise our superintendent that we needed to hold them more accountable, but again, we don't govern those charter schools. So it was a very difficult situation that we had to deal with, but related to our doors in our facilities, cameras, additional BSO, our internal municipality contracts that we have, that's all being implemented based on these policy changes. In addition to that, we also had a state statute, our legislation had implemented a mental health, at least a minimum of 5 hours of mental health education inside our schools and secondary education. So that is actually being rolled out in this second quarter in Broward County schools. Some of our other counterparts in Palm Beach and Miami-Dade have already started implementing it in the first quarter, but we're starting to roll that out within our secondary educational institutions in Broward County.
I would say, add to that, in addition to the safety and security protocols during the school day, at least in Montgomery County and with my colleagues around the state of Maryland, we've focused on a lot of the in-school safety and security, but now we are shifting to beyond the bell safety and security. So we have convened in Montgomery County this year an after-school design team, and the vision here is really building out the structures at the high school, middle school, and elementary school levels in terms of the after-school operations team, certainly administration, security staff, the building services and custodial staff, who are the key players in the building after school, and then structuring out the after-school operations plan for emergency management, not just on a day-to-day basis, but when we have events, and then also the community use that happens in all of our buildings throughout the year. So there's a lot of work. It's ongoing work with the safety and security, but really the Beyond the Bell is something, with the extracurricular activities and athletics, is something that we're really building out, not just in Montgomery County, but this is a nationwide trend.
I'll take one last stab at your question. This is not necessarily relevant to middle school now that I'm a high school principal, but the current school that I'm at is a fairly high-pressure institution for kids, academic pressure, social pressure, self-imposed, peer-imposed, parentally imposed, and the year before I got to Whitman, we had 2 deaths. We had a suicide and another student that died on a cold night after being under the influence of alcohol. We see a lot of those kinds of psychosocial impacts at the high school level. One thing that we started this year, it's called One Whitman. High school kids typically don't have a lot of time to get to know each other, other than those tracks that have been mentioned that they get in secondary education. You hear about advisory periods a lot at the middle school level. One Whitman is essentially an advisory period. It's every Wednesday. Our system, MCPS, has put a real focus on restorative justice. So we implement community circles every Wednesday. And then we've also partnered with the Anti-Defamation League, ADL, and their No Place for Hate program, where we implement lessons on identity development, inclusiveness, racism. And so we're really trying to get kids to build relationships so we can identify students that need more support before we have significant issues at the high school.
Thank you so much. It's very impressive to hear all the different things that are going on to change the course for middle school students. I wanted to ask you if you have examples of where either healthcare or public health has been incredibly helpful, or particularly helpful to the changes that you're trying to make. Or, if failing that, whether you could imagine that either support from a healthcare entity or public health could be helpful. I'm just trying to see, how our worlds kind of intersect a little bit, because there's a lot about redesigning the educational day, all the things you're doing in the educational sphere. Are there any examples of where healthcare or public health have made a big difference in what you're trying to do?
I can share, and it's mostly from the connection of services, really. There's so many services that exist in our community that just parents, families don't know how to get in touch with, and that's particularly in the mental health space. So we have partnerships to bring mental health clinicians into the school on a daily basis, but we also have, through our partnerships with communities and schools, the ability to refer kids out to receive different mental health supports, whether it's psychiatric supports or whatnot. I could say, though, it gets hard. There's not a lot of clinicians that treat kids in this age group, and the ones that are more readily available, it can be very cost prohibitive as well. So I think finding some way to increase the access to specific targeted family or individual mental health supports can be helpful.
About a decade ago, MCPS created what I think was kind of a groundbreaking pilot program. It was called the Kennedy Project. And basically, John F. Kennedy High School is in Silver Spring, Maryland, and it was an interagency approach to supporting kids that were identified as needing rent assistance, mental health support, health support. So it was a group that got together, that gets together still to this day every month, representing the police, Health and Human Services, the school system, and other agencies. And I think it's a very powerful example of the interaction of health and education on behalf of kids. I benefited from it as a principal at both the elementary level when I was the principal of Strathmore and then when I was the principal of Argyle. Our counseling staff could identify specific student needs, kids that were in need, and those cases would be brought to the Kennedy Project, and then we would get assistance with that. It's worked for a lot of families. It's never been brought to scale, but it's a good example, I think, somewhat of what you're referencing.
So when we look at our overall interdisciplinary team in Broward County, we realize that the public health challenges that we have to be worked in conjunction with our mental health team. And so as the policymakers and the safety and security is such a prevalent component, increasing that, having more law enforcement, more security officers in schools, we're also trying to increase more nurses in our schools. And because of the funding mechanism that we have, we're very limited to that. So we're trying to now move in a direction of being more innovative with a tele type nurse inside the school system, to where, because at times where there's students that may have diabetes, it may be tied and connected to some of the mental health challenges or vice versa. Our nurses are our first point of contact. They're our coordination of care. And so really ideally, we're also looking at our community partners, whether it's the South Broward or North Broward Hospital District, with working with us with some of the public health challenges that we have, but we realize that it's like fist and glove. And so we're trying to remove some of those barriers that are currently existing, but a lot of it honestly ties to some of our funding pieces, and trying to be innovative and try to identify other funding sources or utilizing technology to help us meet that need of our children.
On behalf of all the panelists, I want to thank you all for hearing our perspectives on middle schools. I'm excited this afternoon to lean on this topic from more of a public health perspective, to see how we can merge the two in best support of our students. We're going to break for lunch now and reconvene at 1:10, it looks like, after lunch. Thank you.